The nervous system is a complex network. It controls our thoughts, movements, and senses. This system is vital for our interaction with the world. It allows us to experience sensations like touch, taste, and smell. The nervous system also regulates essential bodily functions. These include breathing, heart rate, and digestion. The nervous system is divided into two main parts: the central nervous system and the peripheral nervous system. The central nervous system is the control center, processing information and sending out commands. The peripheral nervous system acts as a messenger, carrying signals to and from the central nervous system. The central nervous system is made up of the brain and spinal cord. The brain is the most complex organ in the body. It controls our thoughts, emotions, movements, and senses. The spinal cord is a long bundle of nerves. It carries messages between the brain and the rest of the body. The brain is further divided into different regions. These regions have specialized functions. The cerebrum is responsible for higher-level thinking, such as language and memory. The cerebellum coordinates movement and balance. The brainstem controls vital functions like breathing and heart rate. The central nervous system is like a powerful computer. It processes vast amounts of information every second. This information comes from our senses and from within our bodies. The central nervous system then uses this information to make decisions and send out instructions. The peripheral nervous system consists of all the nerves outside the brain and spinal cord. It acts as a communication network between the central nervous system and the rest of the body. This system is further divided into two parts: the somatic nervous system and the autonomic nervous system. The somatic nervous system controls voluntary movements. When you decide to pick up a pen, your brain sends signals through your spinal cord and peripheral nerves to the muscles in your arm and hand. The autonomic nervous system controls involuntary functions. These include breathing, heart rate, and digestion. The autonomic nervous system is further divided into two branches: the sympathetic and parasympathetic nervous systems. The sympathetic nervous system prepares the body for fight or flight responses during stressful situations. It increases heart rate, blood pressure, and breathing rate. The parasympathetic nervous system promotes rest and digest functions. It slows the heart rate, lowers blood pressure, and stimulates digestion. Nervous system disorders can affect any part of the nervous system. These disorders can cause a wide range of symptoms. These symptoms can include headaches, dizziness, weakness, paralysis, and loss of sensation. Alzheimer's disease is a progressive brain disorder. It affects memory, thinking, and behavior. Parkinson's disease is a movement disorder. It causes tremors, stiffness, and slow movements. Multiple sclerosis, or MS, is an autoimmune disease. It damages the protective covering of nerve fibers. This disrupts communication between the brain and the body. Diagnosing nervous system disorders often involves a combination of methods. A neurological exam assesses things like reflexes, coordination, and mental status. Imaging techniques like MRI and CT scans can reveal structural abnormalities in the brain and spinal cord. A lumbar puncture, commonly known as a spinal tap, can analyze cerebrospinal fluid for infections or other markers of disease. The causes of nervous system disorders are varied. They can include genetic factors, infections, trauma, and exposure to toxins. Treatment options depend on the specific disorder and its severity. Medications can help manage symptoms and slow down the progression of some diseases. Physical therapy can help improve mobility and coordination. Surgery may be necessary in some cases. Early diagnosis and treatment of nervous system disorders are crucial. Early intervention can often slow the progression of the disease, and this can improve long-term outcomes for patients. Staying informed about the signs and symptoms of common neurological conditions can empower individuals to seek medical attention promptly.